Hi, it's Dr. Jen Kennedy. I'm a sexologist and couples therapist. The Pleasure Project podcast is about sex and relationships. So this includes discussions on desire, dysfunction, dissatisfaction, exploration of all things sex related. So sometimes I'll do toy reviews and we'll look at trends, and sometimes I'll also enlist other experts. We'll increase your insight and enhance your pleasure. So tune in. So in this episode, I am talking about chronic illness and sexuality. So specifically looking at three most common chronic illnesses that affect folks that are 45 to 65 or 70. And those are type 2 diabetes, cardiovascular disease, and multiple sclerosis. So we're looking at some of the symptomology and how that translates into a couple's erotic life, like how those symptoms and how that diagnosis specifically trickles down and affects those folks in those couples in their day-to-day life, and how that's going to interrupt as the disease progresses, or how it gets introduced into their romantic life and how they reconcile that, how they recalibrate and work with it. So tune in for that information, and I look forward to your feedback.
Hi, welcome back. So my topic today is chronic illness. This topic came to me from a listener. She wrote in and said to me, hey, I am married to someone who has MS, and I'm wondering if you could talk a little bit about this topic. And I started thinking about it and decided this is a great topic because I'm sure she is not alone. I did a little research, and in my target age group, which really is 45 to 70, the three most common chronic illnesses that significantly impact intimacy and sexuality are the ones I'm going to cover today. Those are type 2 diabetes, cardiovascular disease, and MS, multiple sclerosis. So I figured let's take a look at these. Let's do a deeper dive into specifically how these chronic illnesses affect partnerships, right? How these affect not specifically what are those illnesses about, but how those impact people's sex lives and partnerships, because that is important, right? It's like, yes, there's the normal aging process that we're all going through, and there's the normal stressors that most partnerships have. But when you add on that extra element of chronic illness, it's a whole nother dimension that these couples are going through. So as we age, chronic illness becomes more common and often more silent, especially in the realm of intimacy, right? And sexual connection. So in this episode, we'll explore how these three prevalent chronic illnesses, specifically diabetes, type 2 diabetes, cardiovascular disease, and multiple sclerosis, impact sexuality, desire, and relational dynamics. So, okay, let's jump in. First, type 2 diabetes. We're going to look at that. Now, type 2 diabetes is one of the most widespread chronic conditions in this age group, specifically 45, 65, 70, and it often has profound effects on sexual function. Symptoms at the outset can include frequent urination, excessive thirst, constant hunger, fatigue, blurred vision. And this is one of those situations, one of those illnesses that requires long-term management, right? There isn't like a surgery that you can do. There isn't a remedy that just happens. This is more of a long-term management situation. And so this is a coupleship that has to change their lifestyle. They're going to be looking at understanding sort of how do we manage this illness. And so this is going to be a shift in terms of how they're eating, how they're functioning, how they're taking medication, considering the person that's affected, but it's also the partner that's affected. And oftentimes when these diagnoses come, it's a loss, it's a frustration, it's a disappointment, but it's also like a recalibration that the couple has to do to decide, okay, how do we move forward from here? How do we absorb this new information and this new acceptance into, like, how is this going to affect our lives and our day-to-day lives? Right? There's a logistics part to it, but there's also our intimate lives. Like, how do we still have not just the business of life, which, everybody has to reconcile about how do we get stuff done? How do we pay for it? Right? There's the financial piece, there's the logistical piece, but also how do we keep and maintain us, like, as a partnership? How do we not just coexist as people pushing through this, but how do we also have the specialness that brought us together in the first place? So some of the specifics that I'm going to point out for each of these chronic illnesses pertain more to, there's obviously a lot of impacts, but these pertain more to the intimacy and sexuality, because that's more the focus that I'm interested in. So looking at type 2 diabetes, nerve damage is one of the impacts that tends to happen, the neuropathy, and that can lead to, with men, erectile dysfunction, and also reduced genital sensation or lubrication for women. So let's unpack that for a minute. If you're having erectile dysfunction, I mean, erectile dysfunction in general happens for men over 50, right? Each decade it gets worse. 50s, 60s, 70s, 80s, we see increased erectile dysfunction. That has relational challenges that come with it. Now, for women, reduced genital sensation, that's a bummer, right? If your genitals aren't having a lot of sensation, that makes it hard for you to feel inspired, feel wanting. If you're not getting much of a feedback loop, if it doesn't feel that good, it might be more challenging to want sex. So also lack of lubrication, which can come with perimenopause, but might be exacerbated, might be accelerated with type 2 diabetes, which means you might have to be seeking more lubrication. So that's just one of the fallouts. Blood flow issues. So blood flow issues impairs arousal. That's part of when women or men feel desire, that desires in the mind, it kicks off arousal. The arousal response is the blood flow. So if it is impairing arousal, then it's going to make more difficult to have orgasms. If the orgasms do happen, they might also feel less intense. So that's challenging, right? If you're having blood flow, which is a side effect of type 2 diabetes, you might also have blood flow issues, which means you might also have less intense or more difficulty with orgasms. Additionally, medication side effects. So that would be more in the way of like the routine that has to come in with insulin. There are different types of insulin. They can be an injection, it can be a pump, it can be a pen that is happening, but that might happen once a day or multiple times a day, depending on the regimen. So it sometimes makes it more difficult to be spontaneous or traveling or that type of thing. There's just that consideration of this has to happen because this is what regularizes the treatment. And so sometimes knowing that there's this sort of orientation toward the medication regimen, it can sometimes make that person feel like a patient, or there's this lack of like playfulness, right? So sometimes that's sort of a side effect of the medication necessity. Another consideration is just the emotional impact, knowing that there's of moderating and paying attention to the lifestyle piece can be frustrating. It can bring shame. There's a lot of attention on weight and sometimes lower energy that comes with type 2 diabetes. And so that can also impact intimacy and impact confidence. Confidence and anxiety are huge interrupters for sexual energy and sexual dynamics between couples. And if the person who has type 2 diabetes or their partner are sort of navigating all of this around their care, it can feel really frustrating at times. It can feel like a lot of management, and there can be shame and, even the shame of having to have the need of paying attention and following the routines and the protocols and that type of thing. Never mind the weight and, that type of thing. So just acknowledging that all of these things can add up to feeling undeserving or feeling avoidant of sex. Lastly, couples may struggle with touch aversion. They might fear initiating, or there might just be miscommunications around physical symptoms. Like, what is happening, and do I feel deserving, and what is my relationship to my body? So noticing that these things are happening and that there's two people involved here that might be making assumptions about what is or isn't happening in the dyad, and keeping communication open. Like, also, I would say on the therapeutic side is I would be looking at exploring sensuality beyond just the performance component, like trying to normalize what's coming up for each party, recognizing limitations, recognizing that maybe there's ways to have intimacy that is more creative, that works with what each of them is experiencing and able to have in the moment. And that's going to come up again too as we look at some of the other conditions. Specifically, I'm thinking of MS. Okay, so second, let's look at cardiovascular disease. So heart disease, including hypertension and other circulatory conditions, is another top chronic illness that disrupts sexual well-being. So common symptoms at the outset include chest pain, shortness of breath, fatigue, dizziness, and swelling in the legs or feet. So oftentimes this is leading to a heart attack. And so on the other side of this, say the person affected has a heart attack or surgery, on the other side of treatment, they are living in a lot of fear of what could happen again, right? Like, what was that? That was really frightening. It could happen again, right? And so I hear this echoed sometimes of like, I don't want to have a really high intensity sexual session because I don't want to give my partner a heart attack, right? Like I don't want to get them anywhere close to that. That's not typically likely to happen, and your medical professional will tell you that, but there is sort of this unconscious fear. Kind of reminds me of when people are pregnant and they don't want to have penetrative sex because they're afraid of hurting the baby, but it's different. But it's sort of like this fear that people carry. They don't want to give their person a heart attack due to sexual activity. Actually, the person, that has the cardiovascular disease or the partner can both sometimes unconsciously carry this fear. So just good to like reality check that, understand what's actually like what they can really handle, and your medical professional will give you some good information about that. The other piece of this, though, is oftentimes when there is cardiovascular disease, there might be reduced stamina. Like if you're trying to match your previous functioning, it might not be possible. You might have lower energy. You might not be able to last as long as you could in the past. You might just have a new normal. So can you accept that? Can you allow that to be okay? Can you recalibrate your expectations as a couple and not have that lead to avoidance because of shame or disappointment, or basically shame or disappointment, because you don't feel like you're hitting those same goals or performance that you used to. So you don't want to have conflict around that or different desire. Medication in this category, such as beta blockers, may reduce libido or cause erectile difficulties. Not saying that's always true, but that can be a factor. So your medical professional will probably give you that information, but also just know that that is sometimes a factor, right? That again, these are medically necessary medications, but sometimes the side effect might enter the bedroom. It might cause challenges. And so we might have to look at other ways that you can connect with one another. It might not be sex in the way that you had it before. It might be more intimacy building. It might be more touch based. It might be, it might look different. I'm hopeful that these couples can remain close and that the dialogue can remain open and that there is a path that doesn't just have to look like penetrative sex, because I'm a big fan of broadening the definition of sex and sexuality and have it look more like intimacy and closeness, because I feel like so much of the time that's actually really the goal of sex, right? It's actually not about that 2 minutes of like orgasmic like release. It's so much about, do you know me? Do you care about me? Do I matter? Like it's about the attention. It's about that interaction that's so, so valuable. So yeah, sometimes medication is really imperative. And so, or pain trumps the need for a certain position or whatever. And so that has to matter. Let's see, another component specifically within the cardiovascular disease to consider is just the mental health aspects like anxiety, depression, or trauma from a cardiac event. Those things definitely can come back to roost. Like there's that piece of like, that was really frightening. And so sometimes that person who suffered the attack might have to get some extra trauma treatment. And so there might be sort of a shift away from certain things or avoidance. Maybe they're afraid to have pressure of someone on top of them, or maybe they're just feeling more mortal, or maybe there's a feeling of helplessness. Like it comes up in different ways. It's interesting, and so sometimes sexuality is an interesting expression of self, and confidence is sort of wrapped up in that. Initiation is wrapped up in that. And so sometimes these chronic illnesses can kind of tackle or divert some of that energy, and confidence gets sort of pulled in different directions and looks, it just gets derailed. The last piece I just want to mention, and I think this could apply to any of them, is the identity shift post-diagnosis can lead to one partner feeling like a patient and the other feeling like a caretaker, which can definitely disrupt the erotic dynamic. And so in any of these situations where one person had a condition and does need some caretaking, that can unbalance the dynamic between the two, because obviously one person is more vulnerable in that moment, and maybe more moments if they're having physical difficulties, if they're having emotional difficulties. And it puts the other person in a more caregiving role. That sometimes makes it harder to eroticize each other. It makes it harder to feel desire, and sometimes having a more fluid back and forth dynamic. I think it's important to talk about that. And I don't think it has to stay that way, but I think if it doesn't get addressed, or if there isn't room for it to have some sort of rebalancing or sharing back and forth, it's not a healthy way to stay in that configuration, because it's really hard to sexualize somebody if you're always taking care of them. Right? There has to be some way to have reciprocation, and it doesn't have to look like it did before. It doesn't have to look like the way they take care of you, but there needs to be some sort of reciprocity. Maybe it's good conversations. Maybe it's they make you a cup of tea. Maybe, whatever. Maybe there's other ways that they can take care of you emotionally, if not physically. But I think it's really hard. We don't tend to sexualize our caregiver. So yeah, I think that needs to be acknowledged and addressed. But also, the therapeutic intervention here is reframing intimacy as safe and adaptable. And we're looking at having these couples have realistic sexual integration, right? Because we want them to feel what's possible at this juncture, and also being realistic with each other of what is our new normal. And the new normal might change over time, might come and go, but what is happening now, and what event specifically, like this is more of an acute event within the cardiovascular disease. If there was a heart attack, for example, that's an acute event that needs to be processed. But then also going forward, what is the new normal? So the last chronic illness that I wanted to talk about is multiple sclerosis. So this one has a very different profile. This one has a longer progression. So it's less common than diabetes and heart disease, but it often begins in mid-adulthood and brings unique challenges to sexual function due to its neurological impact. So common symptoms include fatigue, numbness and tingling, difficulties with balance and coordination, vision issues, and problems with bladder and bowel control. So this changes over time, and also it fluctuates from person to person. It also fluctuates even for the same person. So at different times, there might be different levels of functioning. So that's tricky, because it's not like the same person, and the partner can always expect the same level of functioning. So there's a recalibration that must happen. There's a fluidity in that partnership. And both people have to stay flexible to what's presenting today and what is possible. So some impacts on intimacy and sexuality, specifically, let's break some of this down. Nerve damage. So actually, before we get into this too far, we're going to take a quick break. We're going to talk about the pleasure project for just a minute. So take a break. A quick pause here to share something that I've been working on that I think you will really appreciate, especially if you've ever felt confused or disconnected from your sexual desire. It's a self-paced course that I created for women who want a better understanding of their sexual desire, especially if it's felt confusing, inconsistent, or hard to access. A lot of us are taught that desire should just be there, effortless, spontaneous, always on, but that is not the reality for most people. And when it's not, it can leave you feeling frustrated or like something is wrong with you. If you've ever felt turned on one day and completely disconnected the next, or if you've struggled to say what you really want sexually, if you're both excited by the idea of vibrant sex and hesitant about what that even looks like, this course is for you. Desire is complex. It lives in your brain just as much as your body. And in this course, I guide you through the understanding of your unique relationship to it without pressure, shame, or performance. You'll get short videos and guided worksheets to help you map out your personal erotic template, identify what turns you on and off and what shuts you down, understand the blocks that might be getting in your way, reconnect with your body, and you'll explore your sexual self with more confidence and curiosity. You can go at your own pace. You don't need to want more sex. You just need to want to know yourself better. So if this resonates, then head on over to pleasureproject.us and learn more and enroll in the course. Now back to the episode. Okay, so we're back, and let's talk about specifically some of the impacts of multiple sclerosis. And the first one is nerve damage. So nerve damage affects arousal, sensation, and possibly orgasm. And that's for both men and women. So that's a huge one. If you think about it, obviously our nerves run throughout the body, and they hugely affect how we feel. So if your nerves are misfiring, if your nerves are disrupted, that's sensation, that's everything, right? That's a big pain. That can be a big pain signal. Pain says no to the mind. And so it's going to be hard sometimes to feel like you're going to want pain and pleasure are oftentimes usually typically at odds with one another. And so if you're having pain signals, it's going to shut you down and oftentimes say no thank you to sex. And so it's tricky. It's tricky for the partner. It's tricky for the person. It's tricky for both, right? Because you're not knowing what's going to come on and what's going to hurt and what's going to feel good. And so pushing through some of that is going to be sometimes a no-go. Another issue is the mobility, spasticity. So that's the muscle spasms that can come on with MS, and the fatigue. There can be difficult fatigue, can make certain positions or sustained physical activity very difficult. So again, this can be there can be a range of functioning that is possible, and the fatigue can make it difficult to hold positions that or have sustained longer sessions of sex more challenging. So this is going to be on a case by case basis, right? It's like, what is feasible for this coupleship? What is the level of functioning for the partner affected by MS? And it's really going to be, it's going to require such good communication between the couple, right? It's also, I mean, I would say it's going to require like vulnerability, humility, humor, like, what are we doing today? Like, what's possible? Like, what can we do with one another? Because I mean, sex anyway is kind of weird, right? This act that we do with one another it's such a funny dance. But when you're in that space, it's not a set routine, hopefully. And so when you're in that space and you're sort of navigating one another and you're navigating your needs, when you pile on this extra layer of like chronic illness and what is happening for each other, you're not mind readers. You don't know exactly what the other person needs. You might have a sense of it based on history. What do they like? But then you've got this other layer of like, what is their functioning today? What is their level of pain today? There's also this other piece of like, what do they want? What maybe is turning them on in this moment? That's always an element of what haven't we thought about? Maybe they read something, maybe they saw something, maybe something just occurred to them as a turn on that hasn't ever been there before. Or maybe they've got reduced functioning in some way. And so there's a new variation that we can come up with. And so I think it requires a certain level of certainly flexibility, but also just this coordination of like, let's figure this out together. So kind of just acknowledging that, and a willingness to sort of let go if the fatigue is too great or if there's, difficulty or pain happening. The next thing is bladder or bowel concerns can create anxiety or inhibit spontaneity. And I get it. I've also worked with couples who've had bowel issues for other conditions, that was more IBS or just gastrointestinal challenges. And we've gotten really practical in our sessions. It's like, okay, can you put towels down? Can you have wet wipes on the bed, right? So that you can wipe stuff up. Everything's washable, right? Can you just like have a really practical conversation with both partners and say it's body fluids, right? Bodily fluids. Can you accept that you might be touching some bodily fluids? Like, is that permissible? And is it worth it to you to have this experience and be able to just clean yourself up as needed? I mean, it's not ideal. It's not necessarily the way you would want it if you had like your dream situation, but it's also just what it is. And it's not that big of a deal. Like, so if you can kind of let it go to some degree, it's really not that big of a deal, but you have to get over some of that initial ick, and you have to get over like the logistics of how do we deal with this. I think that's a practical thing. They make some really great, they have these like, well, you can use a towel, or they have these blankets that you can put down on the bed that also provide a barrier that you can then just wrap up and like throw right in the washing machine. They're so easy. I will link one actually in the show notes that I recently covered in a review. And I think that's an option, something like that, so that there is a barrier. I understand you want to be clean, but also it's really not that big a deal. Medication side effects and pain can lower libido and cause distraction. I think I already talked about that. And then psychological stress from the uncertainty or progressive loss of function can lead to withdrawal or disconnection. Yeah, because again, we go to shame in general. We go to shame so easily. If we don't feel certain about how our body's going to function, or if we feel like some rejection could happen, or if there's any sort of like embarrassment possibility, right? We tend to like, and so it's just hard. And, I sit with these couples and I just feel so much tenderness for like these moments of difficulty. And so I just really want to encourage communication is huge in these dynamics, right? We have to have strategies for pleasure. And I want to say that, and sometimes that's about a device that maybe Taboo makes this great pillow. It's like a dense kind of like Tempur-Pedic type pillow that gives a little lift that can put you in assist all kinds of positions. There's just lots of ways to help with what is the barrier to intimacy. Is it a physical barrier? Is there a logistical piece here? Is it a pain barrier? Is it an ick, barrier? Like, what is the barrier? Is it a fatigue barrier? Is it a privacy barrier? Is it a financial barrier? Like, what is the barrier? Like, I'm just like, let's figure it out, because I think that most of these things can be addressed if you are willing to talk about it and look at what it is, So I want to acknowledge that sometimes it's about talking about it openly. And how the illness has affected your life and your sex life specifically. I'm also acknowledging that, yes, there is a loss. There's a loss of functioning. There's a loss of previous, what you expected things to be and what you had before. So planning becomes necessary. And sometimes that can feel unsexy, but it's okay. Like, it's just part of the process. I think that there's some grief in that, and sometimes there's a readjustment. Sometimes there's a readjustment that makes some self-reflection and your own self-image, as well as like the partner self-image, be part of that. The roles that each of you fill, and kind of renegotiate, what are the expectations and what are the possibilities? Because I don't think the sex life has to be over. But again, I go back to the intimacy that is possible. That's what I'm more interested in, always, by far, in every couple that I see, is, yes, I want you to have a vibrant sex life, but I'm more interested in you having a great, like, intimate connection. So is that possible? And what does that look like with desire, with touch, with closeness, with communication? So yeah, I am curious to hear how this touches you and how it affects you, and any questions that you might have. So this came from a listener, this question that prompted this. So if you have other questions or ideas, please reach out. And thank you so much for listening. Tune in.
Hey, it's Dr. Jen. Thanks so much for tuning in. Please leave us a review and leave a comment if something struck you. We'd love to get the feedback. It really helps the podcast. And if you want to reach me, go ahead and direct message me on Instagram, or you can reach me at jen@rivieratherapy.com. Thanks.